I think one of the greatest opportunities in healthcare, and it's something we can all relate to, oftentimes when we move from healthcare provider to healthcare provider, or even insurance carrier to insurance carrier, our information gets lost. We have to basically re-enter manually information on our past, our demographic information, any prior surgeries, and any medications that we're on. Having that information in a portable way and having that known by a customer service representative or a healthcare clinician in advance of you engaging is a fantastic opportunity to, number one, really remove a lot of inefficiency from the system, because anytime we're manually entering information, there's always the opportunity that there's going to be an error. It will also really remove a lot of high-value work from employees that really should be focusing on engaging that employee or that patient to make sure that they're truly understanding their needs. One of the greatest opportunities we really see in healthcare is to not design solely around those instances where the patient's actually engaged in the healthcare system. Oftentimes where the greatest opportunity presents itself is those times in between, when maybe that patient is dealing with a discharge from a hospital stay and they have a multitude of different directions that they need to follow, whether it's getting additional medications, dealing with a wound, or doing follow-up physical therapy, or maybe they've been prescribed a medication to deal with a chronic condition and we have to ensure that they are compliant with that medication. So finding those opportunities, whether they're reaching out for a customer service question, maybe they need to replace an ID card, we're taking the opportunity to really touch base with them and see if they've followed up on their discharge planning or understanding whether or not they're taking their chronic medication, and ultimately if they're not, trying to understand why and then figure out what resources might be available for that patient. So it's really finding those opportunities when they're not face-to-face with a healthcare provider or within the system that really present probably the greatest opportunity. So if you think about the opportunity around automation and even the use of AI, it's a tremendous, tremendous opportunity to really improve and create more efficient workflows, serving up really the next best action to whether it's a clinician in the front lines with a patient or a customer service representative dealing with someone on the phone. And ultimately, that's really the highest, best use of AI, and the opportunity is to really make sure that the customer service rep or the clinician can engage with that patient, can ask thoughtful, insightful questions, can understand where that patient is in their journey, and really make sure that they're fully engaged versus it being a rote experience or an automated experience that feels very transactional. One of the metrics that I think really ultimately creates brand loyalty is this notion of trust. Trust is typically established when you have an empathetic engagement with a product or a brand. The difficult challenge for everybody is, how do we measure trust? It's a really difficult thing in the service industry to really try to understand. So there's traditional things we can look at, like net promoter scores or patient escalations. Are they moving from the chat functionality on your portal and asking to speak to a customer service representative? After speaking to that customer service representative, are they asking for an escalation to a supervisor or a manager? And then you can obviously look at places like Google and Glassdoor, or even better Business Bureau ratings. But ultimately, at the end of the day, that trust is really going to come from an empathetic engagement with that member and a lot of transparency around the way the information is being shared. For patients to truly feel like they're being engaged, the transaction and the engagement needs to feel like it's not simply a transactional relationship. They need to know that they're being heard. And so the opportunity there is, again, to let AI and automation serve in the background to help serve up information to that customer service representative or that clinician to let them know about the next best action. But patients don't want to feel like they're being managed. They want to feel like they're being supported. And ultimately, at the end of the day, if you leave them with this notion that you've listened to them, you've heard, you've asked probing questions, you ensure by the time at the end of that transaction, you've asked if there's anything else that's going on, anything else you can help them with, then I think ultimately at the end of the day, they're fine with having the automation and the workflow serve in the background to make sure that the patient is heard and that the customer service rep or the clinician can be fully engaged in that conversation.